At Grady, we all have a responsibility to ensure the safety of the patients in our care. Part of this responsibility includes preventing patient elopement and falls. Patient elopement is when a high-risk patient leaves their care area unsupervised, without our knowledge. Inpatients on a psychiatric involuntary hold and patients who don't have decision-making capacity are considered to be high risk. If you see a patient leaving the hospital wearing a green armband, tactfully approach and determine if they've been discharged. Call the health system administrator or the operator if you need help.
Call Grady. Call Grady.
Excuse me.
Yes?
I think you're supposed to be in your room.
I'm tired of sitting in there. I just wanted to stretch my legs.
Well, now that you've had a nice walk, let me help you find your room again. Would you like me to get you a newspaper to read to pass the time?
That would be great. Thank you.
Elopement is different from a walkaway or against medical advice, AMA, because in those cases, patients have decision-making capacity. It's also different from a leave of absence, which is a temporary leave given by a physician. Against medical advice, or AMA, refers to a patient who decides to leave the hospital after we've talked with them about their care and the risks of leaving. Inpatients are not allowed to leave their assigned patient care area except with Grady personnel or as part of a leave of absence. An inpatient could have a change in green code status during their admission if their licensed provider thinks it makes sense. If a high-risk patient has eloped, first call the hospital operator, who will announce a code green over the paging system. Next, contact public safety. Third, patient care staff should contact the patient's physician. If the patient is not found within 1 hour, patient care staff will notify the patient's family or designated contact person and ask if they've been contacted by the patient. Then, the health system administrator will notify Grady senior leadership, risk management, and public affairs. Lastly, if the patient is not located after a diligent search, public safety will notify the Atlanta Police Department. If a patient who is not high risk is discovered missing, notify the unit nursing leader and public safety. Be ready to provide information like first and last name, a physical description, and their last known location. Falls in hospitals are one of the leading causes of injuries and injury-related deaths each year. All Grady Health System staff are responsible for preventing and reporting falls. We use the Hester Davis Fall Scale and Javion Artificial Intelligence to identify a patient's risk of falling. Patients at moderate to high risk of falling will be given a yellow armband, and inpatients are given yellow skid-free socks. A sign should be placed on the patient's door showing their level of risk. Fall should be reported to the clinical staff personnel so that they can do an injury assessment. For each patient that falls, the provider should be notified, and a fall event report should be completed in the RL Solutions online event reporting system. That report should be forwarded to the risk management department, and a post-fall huddle should be completed in real time. If you notice that repairing equipment or furniture could help prevent falls, call facilities management. Floor spills can be reported to environmental services, and refer to Grady Health System Operational Policy, Falls Injury Prevention and Management on GradyNet for additional information. When we proactively address elopement and falls, we support our patients' overall well-being. Thanks for everything you do to keep our patients safe.